and a happy new year. My name's Esther and I'm the Chief Executive of Leeds Hospitals charity, previously known as Leeds Cares. So we started the year with a new name and we hope that it will make it easier for people to understand where their donations are going, which is to support work across Leeds teaching hospitals. These video blogs I do every month to highlight some of the amazing people who work within Leeds teaching hospitals and the difference your donations have made to their area of work. So I'm really pleased to be joined today by Professor Ram Subramaniam, and he's going to be talking about some of the work he's been doing with the air seal that was funded through your donations to improve patient outcomes. Hello, Ram. Thank you so much for joining me today.
Hi, Esther. Thank you so much for this invitation, and it's an absolute pleasure.
Can you just tell us a little bit more about why the air seal really makes a difference in terms of reducing the impact on a patient of the surgery?
So, robotic surgery is basically keyhole surgery. And how do you do operations using keyhole surgery? Is to actually enlarge the belly of the child by pumping carbon dioxide inside and creating a space to be able to do the operative procedures. Now, when the pandemic came along last year, there were some concerns raised about virus particles being transmitted through the aerosols. I was a bit troubled by how am I going to get through this risk issue to be able to try and mitigate it and therefore continue the work that we've been doing for these children. And what the air seal does is that it's got a special filter which then prevents these aerosols from being transmitted out into the atmosphere.
That's brilliant. And did you say as the other benefit was that it meant that you could treat younger children because it didn't require as much pressure as without the air seal?
Prior to having the air seal, I had set a limit of 10 kilograms or 1-year-old child just to keep things safe. And what this air seal has allowed me to do is because it's such a safe piece of equipment and the pressures can be lower, the age limit of these children who can be operated upon with the robotics has come down to now 6 months.
That's incredible. So before this was introduced, then would you have had to wait for that child to become a year old or 10 kilograms before you could operate?
If the robotics was not deemed safe for us to do in younger children, then they would have an open operation, which means a big incision in their tummy. Of course, that leads to a longer recovery phase. Whereas now with this, those children can recover quicker and therefore benefit from the minimally invasive surgical options which older kids used to benefit. And if I may just add, I have had parents whose other children, for example, they have 2 or 3 children, and one of them has had for him an open operation years ago, and now their other child, for a similar reason or something else, had a robotic approach. They are able to compare and say how quickly the child has recovered, how much less pain they had. And so those sort of comments make it feel really worthwhile. So overall, you can see the smile on patients and parents' face.
Yeah.
So can I say thank you as well to Esther, your team, and the Leeds Hospital charity, because without which we wouldn't have been able to make this big difference. And of course, the donors who support your charity, I think we owe them incredibly our gratitude. Patients' smiles will in turn express that satisfaction. And again, thank you so much.
Thank you, Ram. That was really insightful and so helpful for our donors to learn the difference that their money makes in enabling us to enhance the patient experience through funding specialist equipment like the air seal and previously the robot. And it is really only thanks to your donations that we're able to enhance the services that are already there, already doing a fantastic job within the NHS hospitals. Your donations provide the funding to do things over and above, and specialist equipment is just one of 6 of our funding priority areas. And these video blogs each month are an opportunity to learn more about how your donations are spent and the difference that they make to patients. So I hope you can join me next month, where we'll be hearing from another amazing person working within Leeds Teaching Hospitals. Thank you very much for supporting Leeds Hospitals charity.